Hey folks, hope you're well. Right, so in this part we're going to cover abstract reasoning, and this is part one of the abstract reasoning course. It's part of the UCAT online course, and I'm going to take you through it hopefully, so bear with me. Okay. Now a bit about us. My name is Dr. Abdul Manan. I'm a medical director at Blue Peanuts. As a company, folks, we've been going since 2003. All the medical directors combined, we have over 30 years worth of experience working with schools, colleges across the country, especially in the northwest of England, and we provide bespoke training to schools and colleges, and also we organise courses online and face-to-face, providing mentoring coaching, especially in regards to UCAT, BMAT, helping with personal statements, and also very importantly making sure folks pass their interviews. So we provide interview training. We have success rates of way above 98%, folks. So we think anyway, we do a pretty good job at it. So bear with me. Abstract reasoning. What's it all about? People ask me, well, you know, funny shapes, funny this, funny that. Why on earth are we doing that? We want to be doctors, we want to be dentists. What are we playing at here? What's going on? Well, this is what I will tell you. It's all about seeing what your ability is like in terms of pattern recognition. All right, so can you see abstract shapes and can you see patterns? All right, can you see that there are common and logical rules going on with a sequence or a pattern and so forth? Can you therefore make sense of it and understand that rule and therefore how a series or a pattern will work out? All right, and this is something that you can develop, you can get better at the more you practice this section of the UCAT. And it's important to be good at it because you need to score high marks. Why do you need to score high marks? Because universities will invariably require good marks of you. And why? Why do they want to test with abstract reasoning? And here is the answer to that. As doctors and as dentists for that matter, folks, we are always looking at symptoms, you know, patients, so they present with symptoms, they present with problems, and we also may have investigation results, we might have scan results, so on and so forth, and we have to bring together a set of symptoms, a set of results or data together to try and make sense of what's going on. So you can see where I'm coming from here. It's all about recognizing patterns, bringing things together, and what you find is from one patient to another, even the same presentation doesn't necessarily look the same. However, you might recognize fundamental key features of the signs and the investigations and so forth, giving you clues as to what's going on here. All right, and you know, as clinicians, what we find is, if you look at this next point, right, in that some information, right, that we come across, whether it's signs and symptoms from our patients, whether it's even investigation results, some information is more reliable than other things. Some information you will prioritize more than something else. So it's about prioritization and knowing when to use something. And again, it's something that abstract reasoning tests to some extent. All right, doctors have to, quite often, they have to sift through information and work out the conclusions and make decisions whilst they do that. So quite often, you see, we are looking for patterns. All right, we are looking at working out whether a hypothesis is true or whether it's false. Now, quite often in that process, what you find is that you have to sift through material that can be distracting, that can be irrelevant, and if you kind of follow through with that information, quite often it can throw you offline. You can go off at a tangent, you can get the wrong conclusion, so to say. And it's about having the skills to kind of weed out the kind of what's relevant and what's not. All right, I hope that makes sense. Okay, so then this particular section is quite a fast-paced section of the UCAT. All right, it's by far the fastest compared to the other sections. You've only got 13 minutes to do it, and there are 55 questions. And I know what you're already thinking, man. You're thinking, oh no, this does not look good. There's just too many questions for the number of minutes, right? It's less than half a minute. This, how am I going to do this? So what I would say to you is, don't worry too much. All right, I've been through this so many times with so many students. the more we practice, the more we learn about patterns, the more we understand, what you'll find is you'll get so much better at this. Okay, so the main thing is that don't dwell on questions for too long. All right, if you do that, you'll waste too much time, and the problem we find is that you don't finish the sections because you've spent too much time. All right, it's all about recognizing visual patterns. All right, it's all about doing lots and lots of questions and be getting very fluent at this. Anyway, the format. Here is what the format's like. You have different types of question. All right, we generally find there's 4 types of questions. Most of them are of the type 1 questions, which are, you get 2 sets of basically sets with shapes in them, A and B, and then you're asked where do the tiles fit into, whether they fit into set A, set B, or neither. That's the kind of common question we come across. You also get the other type of question which talks about a series of shapes, all right, and you are asked to select the next shape in the series. There's another type of question, type 3, which gives you a statement with a group of shapes, and you need another shape to complete the statement. And again, I'll show you examples of those in the next few slides and part of the presentation in part 1 and part 2 to demonstrate. But know that type 1 is the one that you really need to think about. Okay, type 4 is where you're given 2 sets, A, B, and B, and then you're given a set, statement to, and then you need to basically decide which set that belongs to. All right, that you don't see very often. It's type 1 that you'll come across more. All right. Okay, let's move on. Here, now then, keynotes. Initially, you might not see the pattern. As I say, the more you practice, all right, the better you'll get, the quicker you'll see the pattern. All right, and there you go, you'll improve with practice. All right, you'll find that with lots and lots of practice, you get quicker. All right, and you generally maintain a strategy. And I'm going to talk to you about the scan strategy in a bit. All right, don't be disheartened when you start this off initially. I get lots of students contact me. They're like week one into it, and they're really struggling. They contact me saying, "Doc, I can't do this. This is difficult." And I say to them, "Look, you need to persevere. You know, keep at it. Follow strategy, and eventually the penny will drop. All right, you have to keep going. All right. Now, work at your own pace initially. Don't worry about time. You have to give the relevant time. So I initially say about an hour a day in the first 2 or 3 weeks, and then you need to up it to 2 hours a day, and gradually, you know, with that your pace will improve. You'll get quicker and more fluent at these questions. Now then, starting point to these questions is look at shape of objects. All right,